The next skill we're going to do is our assessment. It'll be in two parts, one with a live patient and one with a mannequin. Knock, knock.
Good morning.
Good morning. How are you doing?
I'm fine.
Great. Mrs. Johnson, let me just see your armband here. Okay, good. My name is Rose Mello, and I'm going to be taking care of you today, and we need to do our initial, what we call, assessment. We usually do it each morning and each shift, really, as the day starts, just to see how you're doing and how things progress as we go through the day.
Okay.
Let me just give you a little bit of privacy here. Where's the curtains? Okay. Alrighty. Can you tell me what day it is?
Today is Monday.
Okay.
It's August 17th.
Very good. And do you know the place you're in?
Mm-hmm. This is St. Mary's Nursing Center.
Very good. Very good. And how long have you been here?
Just about 4 days.
Good. Okay.
I'm just here to get some rehab after my surgery.
I see. Okay. All right. Now what I'm going to do is just kind of do a gentle look at your skin just to see if I see any bruising or cuts or anything.
Okay.
Okay. Just turn your arms out. Okay. Looks pretty good. Legs look pretty good. All right. Okay. Very nice. If you don't mind, we have a way of checking for dehydration to make sure you drink enough fluid, and we just pinch the skin up on your forearm.
Okay.
If it comes up and goes down immediately, like yours is doing, yours is very good, you're well hydrated, then that's good. If it comes up and takes greater than 3 seconds to go down, it's usually a sign you may be dehydrated, but you're doing great. Your skin looks good there.
Good.
Now, the next thing I'd like to do, if you don't mind, is just to shine a light in your eyes.
Okay.
I'm not going to touch your eye, but I will ask you to just follow my finger and just look at that. The light will be bright for a short period of time.
Okay.
Okay, I'm going to turn these lights off just so we'll be able to see.
Okay.
Okay, if you'll just follow my finger, and I'm going to shine the light in your eye.
Okay.
You've got a little black spot called the pupil that I'm looking at to make sure it's opening and closing as the lights are bright and as they get dark.
Okay.
Alrighty, and then I just want to touch your cheek here. Okay, your sclera, the white part looks good. The conjunctiva looks nice and pink. It's not pale. So those are all there indications of things that might be wrong, like if it's jaundice, it could be a liver problem, but you're looking great. It looks nice and pink. Yes. Okay. If I could take and get you just to open your mouth, and again, okay, and just stick your tongue out a little bit. Good. Looking just at your gums, your tongue, your teeth, just to see if everything looks well there, and it looks nice and pink and moist. Another sign, if it was dry, could be a sign of dehydration.
Okay.
And it seems like you can hear me pretty well, okay? Do you have any trouble with hearing?
No.
Okay, very good. Now, the next thing I'd like to talk to you about is a little private, but we always have to ask this. How often do you normally have bowel movements?
Usually every day.
Okay. Could you describe the color and the consistency of it?
Soft and brown.
Okay. The consistency could be formed, it could be semi-formed, or it could be liquid. And the colors can range in any form or any shade of the browns. And everybody has their own version of small, large, and medium, so we take it as we get it. The other thing I need to talk to you about is your voiding or your urinating. Have you been to the bathroom to urinate this morning?
I was just up.
Okay. And could you tell me, was it clear yellow, cloudy yellow, any special
It's just
odor?
clear yellow. No.
Okay. How often do you normally go to urinate to the bathroom?
Well, it depends how much I'm drinking, but I'd say
Okay.
probably every 4 hours or 6 hours or so.
All right. Do you have to get up at nighttime?
No, not usually.
Okay. Very good. Very good. Okay. And you don't have the urge to go frequently, do you?
No.
You usually do quite a bit when you go? Okay. Good. All right. Now, the next part I want to talk to you about, do you have any trouble walking when you stand up? Can you just kind of stand where you're at?
I can.
Okay. All right. Good. Okay. And you want to just sit back down?
Sure.
Very good. Okay. So you're pretty good with your standing. You're pretty stable there. Could I get you to just pick the pen up off the table?
Like I'm going to write something?
Yes, ma'am. And you
Okay.
can just pass it to me.
Okay.
Good. I was just checking for your coordination there.
Oh, okay.
So what I've looked at is for coordination as far as could she have fine motor movement doing things there. I looked at was she able to stand up, and when she stood up, was she able to maintain her balance, and she did that very well. Now I'm just going to check the strength in her hands, the grip. Just squeeze my hands. Okay. The reason why I'm going opposite, sometimes we forget which is left and which is right. This way I know this is her left, I know this is her right. Okay? So that's why you saw me cross my hands like that. Now, the next thing I'd like for you to do is just move your feet in and out and just circle your ankles around. Good. And just move your arms out. Looking for your range of motion there.
Oh, okay.
Very good. Very good. Now, do you have any questions for me?
No, I don't have any.
Okay, well, everything looked great this morning.
Okay.
So what I'm going to do is, do you want to go back to bed or do you want to sit in
No,
the
I'm
chair?
going to sit in the chair.
Okay, well, I'm going to leave your call light right here and your
Okay.
water pitcher. I'll go get you some fresh water and some ice.
Okay, thank you.
Do you need anything else?
No, I'm fine, thank you.
Okay,
Okay.
thank you very much.
Sure.
Now we'll go to the actual mannequin to do the lungs, the heart, and the abdomen.